there's no FDA approvals for treatments of muscle, joint, tendon, etc. In Australia, Europe, or America. But in China, India, the former states of the Soviet Union and many other countries, Latin America, they are in fact doing stem cell treatments for these. Is there any access to their data? Are they providing data to see what their results are like? I mean, obviously it'd have to be trusted data, but does the US have access to those results to see if they're successful?
Not really. And let me explain where the whole field of stem cells, at least in our little narrow part of it in orthopedics, is going. So it used to be that over the last 10 years, people got very excited about injecting cells into joints and into tissues, thinking that that would boost the healing. And those cells were grown up in laboratories in tissue culture, or they were taken from your own body and concentrated and then given back to you in some volume or another. And that was usually 100,000 cells or a couple of million cells. And it turned out that many of those cells actually died upon reinsertion or didn't do the function that we were hoping that they would do. It turns out also that you, at any age, have billions of stem cells within your body. Stem cells live on the walls of vessels. They're called pericytes. When you get an injury, it's something as simple as a bruise. There's a clarion call out to your cells to come rush to the site of injury and heal it or direct the healing response. And so the entire field of stem cell biology in our orthopedic niche is now moving away from injecting a few cells and towards using chemotactic factors or recruitment factors that mobilize the billions of cells that you already have within your body to increase their attraction, their migration to the site of injury. So let me explain. So something simple like PRP, the blood, the platelets in your own blood, that we take out a little bit of your blood today and we spin it and we get those platelets which contain growth factors and we concentrate them and put them back in your injured tendon or arthritic knee. Well, within those growth factors are very potent recruitment factors. And probably the way they work is they recruit your own body's billions of stem cells to migrate to that site of injury. So long story to explain that where the whole field is going now is not about injecting more and more cells, but injecting recruitment factors. And we're getting better at doing that. We have a public nonprofit research foundation here in San Francisco called Stone Research Foundation, stoneresearch.org. People can look at more information about this. And we have studies going on now about how we use these factors to accelerate tissue healing, accelerate cartilage repair. For instance, why does it take a year to come back from an ACL injury? Can we accelerate how fast that healing occurs? And that is by mobilizing your body's own cells.